You are tuned into the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD, MBA. The purpose of this show is to help mitigate health disparities, improving literacy related to health, economics, and education. For all your professional development, professional management, and educational support services needs, contact Test Taking Solution, where we're igniting success. Located at 2104 Thousand Oaks Drive in Jackson, Mississippi. Literacy is knowledge and knowledge is power. Thank you for joining the Literacy Hour.
And we have the app.
So the app they can download from the App Store?
Yes. If they just MSDH, they'll pull up the health.
Got it.
And it's all the.
Oh my gosh.
It makes it real easy for you wherever you are just to pull up.
They ought to have seen more hits on that thing last year and this year than ever before.
MSDH Healthy App is the name of the app.
Good app.
Section for women and children.
And that's where we really want them hitting up. You watch. They want the information, Dr. Edney. From their app store. I love it. We got to let them know. And I'm going to start sharing that every literacy hour so we can continue to see people getting informed and making better choices. We can make a difference. This is our state. And tell Overseer, I want him to, Mr. Overseer. Okay, he just went out, but he's going to be ready to play that for me.
For the people's seat on Tuesday, October 1st, by electing Marcus Chew as your next city councilman. Ward 2. Your voice, your vision, our future. I am you.
Beautiful. Thank you.
Marcus Chew, councilman, city of Jackson, Ward 2, a proud WNPR underwriter.
Yeah, I was going to let him know when we're ready for sound, but we're not ready for it right now. We're ready to start back whenever you're ready. Tell us what to do. A lot of activities going on this weekend, it looks like.
A proud WNPR underwriter.
All right, and it appears. Are we back? Okay. Thank you so much, Overseer. Wonderful. We are back. And for those of you just joining in, we're here on the Literacy Hour with Dr. Daniel Edney, our Chief Health Officer, Mississippi State Department of Health. And during the break, Dr. Edney gave me some exciting news, and I got to share with you. You know, I can't keep it to myself. I love the msdh.ms.gov website. Well, he just shared with me that we also have an app. You all, we got the MSDH Healthy app. And boy, wait till you get a look of it. Look, download it from the App Store. You're going to see boil water notices, going to see information on the app about women and infants, women and children. That's what we're talking about today. It is Infants Health Month. And we're back. Right before the break, Dr. Edney and I were talking about how the State Department has really divided the state up in regions to better tackle some of the health issues and social determinants of health that we all are experiencing in these regions. And he was saying that he's from the Delta. He's a Delta boy. And the Delta region is a well carved out region. So, Dr. Edney, what led to your decision to take this region-based approach? And again, talk about some of the outcomes you've been seeing, because I know that as a physician, and when I was training in residency and even in medical school when I was in Iowa, I just saw that the Delta had been studied so much. Everybody and their mama, that's what we say out here, had just been studying the Delta to make the Delta better. And it still looks It's about the same as before I left. So are we going to make a difference this time?
Well, it depends on the choices we make.
The choices.
I don't know if we are going to make a difference. If the question is, can we make a difference? Absolutely. Despite billions of dollars being pumped into the Delta at every level imaginable, in many ways, things are worse, not better. And certainly, in terms of healthcare and access to healthcare, they are worse today than they were 15, 20 years ago.
I agree. That's what I'm seeing.
But there are solutions, and there's a lot of low-hanging fruit.
Mm-hmm.
So one thing we don't do very well is we don't play well together.
We don't play well together.
There's so much work going on in the Delta, but you said before the left hand doesn't know what the right hand is doing. We finally got HRSA, which is,
Yes.
the federal agency looking at rural health, to give us a list of every grant awardee in the Delta.
Beautiful.
And what they're doing.
Beautiful.
So
you've gotten the list?
Yes.
Good. I know you're reviewing it.
So we can collaborate and not duplicate.
Yes.
And but the biggest thing, and federal grant dollars don't make this happen. We need community partners, folks who care, like test-taking solutions.
Yes.
To do some simple education. We need our young women throughout the state, but particularly in the Delta, to value prenatal care.
Gotta value it.
And understand that going for prenatal care early reduces your risk of death and gives you a better chance of having a healthy baby than if you're waiting. Every day that you wait, you increase your risk a bit. And we have too many of our moms in the Delta who are showing up to delivery with no prenatal care.
No prenatal care at all. Now that's scary.
And then also to understand simple things that we can do to save babies. I need everybody listening to understand the number one cause of infant death, and that's 0 to 12 months. So right from birth to their first birthday. Number one is premature birth, low birth weight babies. They drive the bus. Number two, genetic abnormalities, birth defects. Can't do a whole lot with that other than women planning their pregnancies and making sure, if you're older, then protect yourself from pregnancy, where genetic abnormalities are more common. The third highest cause of death is sudden unexplained infant death. And we can avert that just simply by putting babies down to sleep
on their backs. Sleep on their backs.
And I'm a granddaddy at 5, and I'm here to preach to my fellow grandparents. If you are babysitting, don't do what we were taught with our babies. Do what the science is showing us and put these babies down on their back.
Because evidence matters, Dr. Edney, like you're saying.
Sleep sacks work.
Sleep sacks work.
So swaddling and using sleep sacks, very effective. And grandparents especially, get rid of the raggedy crib that you use with your babies and and if you can't afford a crib, the Department of Health can help get you a crib. Many of Medicaid managed care organizations can get you one. I believe Jackson Hines has a crib program.
Yes.
We will help get you a safe, state-of-the-art crib for your baby to sleep in.
Right. And as they grow too, Dr. Edney, car seats. They're
car seats,
yeah.
we can get those for you as well. And then please, please, please do not sleep with your baby.
Because you may suffocate the child, you all. The baby is too small.
We lose too many babies every year to strangulation, getting wrapped up in the bed sheets, or mama or daddy accidentally rolling over onto the baby during the night and suffocating the baby. And that is such a tragedy. And it's all preventable. So back to sleep, that's the easy way to remember it. Just back to sleep, put the baby down on their back, use sleep sacks, use safe sleeping environments. Do not co-sleep. Don't put the baby in bed with you. Don't even put them in bed with you for a nap. And I know
they're so cute.
Tired.
They're so sweet, though, Dr. Edney. It's hard. We want to hug on them and kiss on them. But after we do all that, we need to put the child back
but you don't
to
want
sleep.
to you don't want to be seeing that baby
in a casket. So you hear that, you all? I hope you're listening. As much as you love your little doll, and they are dolls, I tell you, beautiful babies. They just so kissable and huggable. We want them to live. And to do that, we need to follow what the experts are telling us, what the evidence shows. And Dr. Edney has listed it off here perfectly. These 3 top causes of infant death. It's Infant Health Month, you all. We're focused. So premature babies, low birth weight babies. Moms, we want you healthy. What you eat many times get passed along to your baby. You guys are connected. So if you're abusing drugs and alcohol, guess what? Your baby is exposed to those substances. And nicotine. So we want to be aware. And the best way to become aware is to listen to shows like this, but also access your health department. Dr. Edney, are we blessed in that all 82 counties has a health department, or, sir, are some counties serving multiple counties?
We have, out of 82 counties, we have health units, and 80 of them. Issaquena has less than 1,000 people there, and they share the health department with Sharkey and Rolling Fork, but Issaquena County helps fund that. So the Board of Supervisors provides funding so that it truly is Sharkey Issaquena Health Department. Benton County in North Mississippi, another low population county, does not have its own unit, but we serve folks in Benton County with the surrounding units. When I took office 2 years ago, and Lord, it seems like a whole lot longer than that.
It does.
2 years ago, we had about 35 county health departments that were open 5 days a week. We are now, I have worked hard to get us back open as much as we can, and we have doubled that number.
Beautiful.
Around the state that are open every day.
Ready to serve the people.
And what we are doing is we are moving to a super clinic model where we'll have at least 30 clinics around the state strategically placed that will do everything every day with a provider there every day. Instead of sending the providers around,
yes, sir.
We used to, I told them, stay put. We'll get the folks to you because we need folks to know where to get to every day and know that we're going to be open. Not hope we're going to be open,
but know that we're
going to be open.
Relationships.
And then and in the smaller counties, we're using our transportation to health program to pay for an Uber ride.
And I'm so excited about that program.
And telehealth. And so that's a much more cost-effective and more efficient way to provide core public health at the community level, and getting away from the old county health department mentality to community health departments.
I like that.
You know, you and I know
it's a community focus.
It's community focus, and the communities aren't delineated by county lines.
No, sir, absolutely not.
And I told my folks, if you want to know where community is, watch where folks go to Walmart.
I love it.
And if I know in West Mississippi, folks from Port Gibson go to Walmart in Vicksburg. Folks in Rolling Fork go to Vicksburg.
See that?
Folks in Fayette go to Natchez.
Well, and folks in Noxubee County don't have a Walmart. You see, so they travel across those lines, and I'm glad you realize that. That's why I laud the work that you're doing, Dr. Edney, because you're not just sitting in the office. You're here at WMPR 90.1 FM, the voice of the community this morning. You didn't have to be, but you are, because you care. And I'm excited. So please forgive me for being overly excited that finally it seems like we have movement in the right direction where our healthcare is concerned. Now, syphilis, because, we're winding on down and we have 15 minutes. Syphilis update is available on the website as of August 8th, 2024. We're sitting now at September 19th. And it was provided by our state epidemiologist who falls under you, Dr. Catherine Taylor. And she's been doing a great job, by the way. This 2024 data, though, is understandably provisional at this point. But there have been talks about hotbeds right here in our state. And yet these hotbeds are not highlighted, if you will, where these increased syphilis rates are. They're not highlighted on the website. We want to know where these hotbeds are. And I'm just wondering, can you list the counties seeing the highest rates of syphilis so that our people are informed and they begin to look out for their fellow man even more? We listen, everybody, I say it all the time, and I think a lot of folks agree that when we learn better, we do better. And so we have to be informed. And I'm looking to you and your team to keep us informed, not only with the website, msdh.ms.gov, but now with the app, MSDH Healthy App, that you can download from the App Store. So again, Dr. Edney, these hotbeds, where are they? It looks like Hinds County is one of them, but I'm not sure.
You know, it is. And we have a special button on the app for syphilis, so we can go there and learn more. But we have 6 counties that are special interest to us based on the numbers and the rates. And they're all high population counties, except Jones County is not one of our higher population counties, but it is very high risk in terms of our rates are far too high in Jones County and Forest County. And then Hinds County is very high risk. DeSoto County, which is coming out of Memphis, Harrison County, which is coming out of New Orleans, Mobile, and we also have a lot of concern in Lee County. So there, and then all of our university counties, Lafayette, Oktibbeha, Forest County again, Hinds County with Jackson State are high-risk counties. Lafayette, Oktibbeha aren't as hot as Forest County is, but what we are doing, and I'm very proud that we've pretty much been told that we're not going to get more agency funding at the state level, and we are very low funded at the state level compared to our sister states in the Southeast.
But we're dealing with a lot of health issues around our state, and you guys are low funded from a state standpoint, you're saying.
Very low funded.
Mm-hmm.
But I was able to convince our friends at the Capitol to invest in population health issues like maternal infant death and syphilis. And we did receive $2.9 million extra with a lot of discretion for us to use. And I put half of that into maternal infant death with Healthy Moms, Healthy Babies, because the Medicaid funding doesn't cover the cost of those nurses.
High risk.
And the OB system of care, which is going to cost about $1 million to build that. And then a significant part of the residual into our syphilis work and our syphilis task force work. And we're partnering with especially the big 4 universities to educate the student bodies and recruit them into helping us raise awareness about syphilis, and with the hospitals in those counties to aggressively screen the populations through the emergency departments, and then for us to push treatment close to testing. And that's been a problem that someone would be positive for syphilis, and then we would have trouble finding them to get them treated. So now we're pushing the long-acting penicillin as close to testing as we can, including providing the medicine to our physicians and providers, hospitals and clinics that are helping us in the fight in these high-risk counties, that we're providing the medicine to them instead of making the patient come to the health department.
That's right.
Just push the medicine out.
Go ahead and give it out.
Just give it.
I love it.
We're sending nurses out with a disease investigative specialist so that when we actually do the contact visit and we find the contact, just give them the shot.
Just go ahead and give them the shot. That's right.
And not put those extra steps in there that's causing us to have people fall through the cracks.
When will you know that this is making a difference, Dr. Edney? Like, are we able to track it? Is it easily tracked?
And we've been working hard on syphilis for, I mean, if you remember, I placed the emergency order April a year ago for all pregnant women to be tested.
That's right, 3 times during the pregnancy.
That it's mandatory testing, that providers must test, and that has already helped. And so our forecasting is looking better, and for 2024, and then with this extra money that we received to be able to really stand up our syphilis work even more robustly, especially in the 6 hot counties.
Yes.
That I think we'll close out 2024 in even better shape than I had hoped. But we're looking at being better from a horrible beginning point.
Of course, and I'm glad how
the biggest thing are the babies. It is absolutely ridiculous
congenital
in
syphilis
2024 to have babies dying of syphilis. And this is something that all of us have to take seriously. Every community has to take seriously. But we just have to get the word out that syphilis is killing babies.
And it's preventable. It's preventable. We can cure it. It's curable.
And this all started in 2017.
Yes. And now, we saw it.
And now we're fighting those numbers back down. We'll get them back down, but we need everybody's help.
Everybody. We need all of your help, all of your friends' help. Get tested. And I know it has a lot to do with the stigma that when you're tested and you're found to be positive of some sexually transmitted infection, STI, sexually transmitted infection, that you feel like your business is going to be put in the street. But let me tell you, at the health department, as well as at your physicians or other providers' office, they are regulated. They are obligated to protect your information. Your patient healthcare information is confidential. It's your information. And if you find that someone has breached that, there are things that you can do. There are steps that you can take to have that corrected, to have those people reprimanded, and have something done. But I don't think you're going to find that happening much, because I haven't heard of healthcare providers leaking that kind of information. Now, syphilis is one of those required reporting diseases. Of course, if you get tested, and when you test, we have to report that back to the State Department of Health. But in that reporting, Dr. Edney, you all protect that information as well, don't you? De-identifying the person and giving them some sort of number.
And even when we're working the contacts, that we protect patient privacy to a very, very high degree.
Good.
And I tell folks, just remember, we do a lot of services at the health department. So just because somebody's coming to the health department doesn't mean that they're being checked for syphilis.
Oh, I'm glad you said that.
They can be there for family planning. They can be there for WIC.
Right.
They could be there for TB. Tell folks whatever you want to tell them, but come on to the health department and get you, if you are in a high risk situation, then come and get tested, because it could save your life, and it could certainly save the life of your baby.
Wow. We've talked about so much this morning, and we still have about 2 more topics to cover. We still have good time. And I just want to share with you all that we have Dr. Daniel Edney, the Chief Health Officer of the State Department of Health, in the studio this morning, WMPR 90.1 FM. I'm Dr. Liddell, your host. We also have our producer here, Mr. Sherry Jones. Mr. Jones, how are you this morning?
Oh, I'm wonderful, Doc. Thank you so much. I don't want to get involved in the conversation because we could take it several different ways. And we got a few more minutes, so we'll take a station ID in a minute. I know you got something that you want to play, so we'll try to make arrangements from that. But Doc, I want to shift the conversation just a little bit. Dr. Liddell, you had an opportunity to participate in a women's conference this past week.
Sure did.
And it was a little bit different type conference, Dr. Edney. Normally, and what I'm concerned about in the African-American community is how we're coming out of the pandemic. And we're still doing things like we were doing before the pandemic, traditionally in the African-American community. But this conference was put together a little bit different. All of the speakers was powerful, and people that have been around for years said that this was the first time that they've been in a conference this powerful. So I'm interested in sharing with you how that happened, because I think the Department of Health need, in my opinion, to have infrastructure in place. You need those relationships. I'm concerned when you sit here and say we got babies dying, that our leaders and people that's listening this morning, and some of them in leadership positions, some of them are pastors, are not outraged and not calling the Department of Health to find out actually what's going on. All right, Dr. Liddell, if you will, just briefly share with Dr. Edney and the listeners, because you've been in a lot of conferences.
Yeah.
How is this conference different than your regular, normal conference?
Right. I attend a lot of medical conferences. And I would say, and Dr. Edney, I mean, I don't even have to, teach him about what happened. He can almost imagine. It was a community-based conference that had experts speaking to the community and listening to the community. They asked questions of us. And I spoke about reproductive health, syphilis, and some other STIs, just trying to, again, get the information out, encouraging us to protect ourselves. So we're just so grateful that Apostle Vera Bishop and Mrs. Cassandra Jones, they were the hosts of the conference. But this women's conference also involved men, Dr. Edney, people talking about investing and these social determinants of health that you mentioned. I am thrilled. I used to say it when I was in medical school, that it's not all about the medicine. It's not about that prescription. It's about the relationships providers have with the patients. And it's about doing a community needs assessment, understanding what this community needs. And the needs are different. So we got a chance to hear what some of those needs are directly from the people. And it's what we already know because we've been listening. And then we got a chance to impart knowledge and information. And I want to share now, Mr. Jones, that Dr. Edney's team was there, even though they weren't there. Let me tell you how. Yeah. They provided information.
And you provided it on a stream, right?
Absolutely. I put it up.
And Dr. Edney, the thing about it is, my pastor, Pastor Charlie Clark, said he was just blown away. And the reason I mention that is we are going to have to change with respect to the church. We got women that just don't know. We got young people, especially, Dr. Edney. It's been a pleasure to be able to work with you, Dr. Ali, and travel. I spoke with a young man at a meeting over in Meridian a while back. And we had the age table set up, Department of Health table, 15 years old, came up with the hoodie on.
Okay.
Dr. Liddell deal with him on a regular basis.
Okay.
But one of the questions was, I asked him, I said, are you sexually active? He said, oh, yeah. Mm-hmm. I said, are you familiar with syphilis? He said, no. All right. So 15, 16 years old, you're sexually active and you're not aware of what's going on with syphilis. Well, I mean, if you didn't get it in the home, Dr. Edney, which we need to start figuring out how to teach it and deliver it. If you're not getting it at the schoolhouse, and there's so much controversy going on there, teachers cannot teach it. But you should not skip the church house, because the churches are faced with those mothers that's struggling at the end of the day. The pastors are having to counsel. The young lady in our church, pregnant and got issues going on. So we got to figure out how to put these programs in place, partner with the Department of Health. But more than anything, if you will, hit that ID for me, Apostle. Give me just a second.
And Mr. Jones, I know we're streaming live too. You're going to give us a few more minutes on this other side.
Yes, ma'am.
Excellent. It's a great conversation.
When you got the head of the Department of Health in, you change things around a few minutes. Yes, ma'am. But what I saw in this particular conference, Dr. Edney, was the leaders of the church, the pastors, that were sitting there like little students, like children, because they were learning. And then they can take that and go back to their church, their congregation, and plug it in. So at some point, we need to develop the infrastructure, in my opinion, and begin to bring the leaders in. Because I'm being honest now, a lot of them just don't know. Now, when you have syphilis exploding in 5-6 different counties, my question is, what are our churches doing? What is the leadership doing in those counties?
Are you saying billboards and stuff like that alone aren't going to help?
You got to make this personal.
Uh-huh.
I'm saying, Dr. Edney, that we got to get our leaders, and you and I have had opportunity to meet with Dr. Buckley, the president of the Baptist Association. But you're going to have to do this on several different levels, and people are going to have to, if they will, want to learn and get involved. My pastor have set aside Bible study to let a doctor come in.
They were receptive.
My pastor have, and not only my pastor, but Pastor C.J. Rose gave up a Women's Day event. Everybody was in red and beautiful, but he got up and yielded the microphone to a medical doctor, Dr. Bertrand Muhammad. Mm-hmm. We was up with Pastor Ray for Easter Sunday in the Mississippi Delta. He said it won't be the bunny rabbit and Easter eggs this Sunday. The health is too important to our people. You understand what I'm saying? So when you're in a crisis mode like this, moving forward now, we just gonna have to change how we delivering this information. So we're gonna move forward and do it. I thank God for the work that Dr. Liddell do, because she gave a one-on-one reproductive session, and you know, it was powerful. But the people left that conference saying that we want to know when can we do this. They was hungry for the information, and now the other thing, Dr. Edney, the conference was much too long. Everybody agreed with that, from 8 o'clock that morning to 4 o'clock that afternoon. But guess what? People didn't leave. Am I right?
No, they didn't. They weren't tired.
They did not leave.
Well, medical conferences are like that too, because it can be that long and have breakouts. Mm-hmm. So there are ways to do it. I think that we have so much information. Look at us here this morning. Dr. Edney and I have talked about breast cancer, colorectal cancer, cervical cancer. We've talked about infant health. We've talked about syphilis, community health, population health, and we haven't hit sickle cell anemia. It is Sickle Cell Anemia Awareness Month. Okay. And we're going to hit that here as soon as we're done with this conversation.
No, I'm good. I'm done. I just appreciate the work that Dr. Edney is doing. I appreciate the work that partners in the community is doing to take that. But I'm concerned, and I think we're headed in the right direction.
Yes.
But when I hear Dr. Edney, much like the homicide rates, it just piques my heart to know that a baby is given a death sentence before they even come in this world.
And we don't know how many of our fetal deaths, how many of the miscarriages in the state. We have a very high rate of miscarriages. We don't know how many of those were related to syphilis. There's no way to have tested for it. So it's this permeates what we do. But the most effective way to impact all these issues is through primary prevention, which is education, and doing it in the community, for the community, and the way the community needs to receive it. Mm-hmm. So a 63-year-old white man from Vicksburg is not going to know how to properly communicate to minority communities in Adams County or Wilkerson County. I know how to talk pretty well in Warren County.
Okay.
But it's different around the state.
Let me share why.
Let me ask you: do you think that folks are going to listen more to me or to your pastor and your community?
That's why I made the point that at this point, our leadership, those that got that pulpit, I get it out. Mm-hmm. They need to be willing to come in. So it means that, and don't get me wrong, what we were excited about this past weekend, we changed the way pastors are going to deliver.
They can.
When they go back to their pulpit, and also how they're going to be conducting business in the church, and when they do the next conference.
Let me tell you how pastors can save the largest number of babies.
Come on.
Is to help us educate the young women throughout the state for the need for prenatal care.
Okay.
Yes.
And to value that. And we have too much of, well, my grandmama didn't need it, and my mama didn't do it, and we're all fine. But your grandmama probably didn't have the chance to.
Mm-hmm.
She probably didn't have the opportunity and to have access the way young women do today.
Mm-hmm.
So, I'm grateful that your grandmama survived. But there are a lot of grandmamas who are not alive today because they didn't receive prenatal care.
They're not here to tell
and
it.
they died in pregnancy.
That's right.
And we have got to get those numbers down, and education is what's going to help more than anything. Department of Health, we're going to do the heavy lifting, the expensive stuff like the OB systems of care and healthy moms, healthy babies that cost millions and millions of dollars. But how much does it cost to educate within the community?
Right. And then there is a cost that goes along with it, certainly time and effort, and making sure that the information is accurate. That's what's very important, scientifically backed. We care about evidence in the medical world. We can't be talking out the side of our necks, and that's why I'm glad we did have school on Saturday. Pastors were there, and we shared information from reputable sources, the Centers for Disease Control and Prevention, the Mississippi State Department of Health. I stress that people can go to these sites to find accurate information. I want to mention breastfeeding. Breastfeeding infants is so important because we know that breastfed infants are healthier, and these resources that Dr. Edney is mentioning, our pastors should be aware of so that they too can share with their congregations, are available. These resources are available. Women, Infants, and Children Nutrition Program. Women, Infants, and Children. WIC. That's what WIC stands for. Remember I told you, don't just hear these acronyms and not know what's going on. That's what it stands for. Women, Infants, and Children. The WIC program, and it's there for us. And so providing healthy food and other resources, they're there. And people need to know that these resources are available.
And
Healthy.
That includes lactation specialists.
Wow.
At no cost.
At no cost for those that are eligible. Isn't that something? I mean, these sorts of resources,
and our WIC numbers in Mississippi are way
they're too low.
Which makes no sense.
They don't know about it. That's
we've got to get the word out, and WIC is a wonderful program.
Yes.
And it's just as important for the mama as it is for the baby.
Well, I remember WIC. I'm a child from Macon, Mississippi, and my mom was a recipient of WIC, and I remember us going up to the health department or someplace nearby there. They had a warehouse you could get your food.
You had to go to the WIC store.
You sure did.
But you don't anymore.
Isn't that something?
You have your WIC card that's electronic transfer, and you go to any WIC approved grocery store
and get the food.
And
if you got one nearby.
And we work hard to do that, but we do have food deserts.
Still in our state.
There are places, especially in the Delta, where a grocery store is going to be more than 30 miles away. But we're working on solutions for that too, through home delivery and different projects like that. But now, there's not that stigma of having to go to the WIC store.
Yeah, and people don't want a handout, Dr. Edney. In my experience, they don't want a handout. They don't want the legislators and other powers that be to feel like they're providing a handout. We want a hand up. Empower these communities to help themselves. We know that it's a food desert. And so instead of delivering the food, help us get a grocery store that will employ some of the folks right there in the community who will have buy-in. So it just seems to me across our state, and you don't have to comment on this. It's Dr. Liddell. This is me and my comments, you all. Economic development is being half done across our state. Some places are going up while other places are remaining stagnant or not growing at all. And that's why I'm so excited about the National Science Foundation and its regional engines program that they've been putting in place and rolling out. As a matter of fact, Tulu College is an applicant and will know mid-October whether we have made it to that final phase. So is Ole Miss and Mississippi State and Southern. But how about I don't hear anything about the Delta, you see? Because perhaps they weren't even aware of this $160 million grant funding that could get us a store, could get us potentially a hospital, and so on and so forth. So we know all this stuff takes money, but we see, some folks believe that these programs are handouts, and some folks don't like these programs because they feel like somebody is giving somebody something. Well, how do you feel about that, Dr. Edney? And what would be your response to folks who think that they really are giving something to these Mississippians?
Oh, good grief. We're giving stuff to everybody.
There you go. That's a great response. I like that.
As a taxpayer, I'm not going to worry about that. If I am blessed to have been able, through the grace of God, to have had opportunities to be educated as a low-income Delta boy whose parents were low-income workers in the Delta and didn't have insurance. I was the first college graduate. So, God's calling me to medicine was a very real thing, and he made the way. And so I understand the importance of opportunity.
Yes.
And there's a difference in providing opportunity versus trying to manufacture outcomes. We're trying to promote outcomes. We're trying to facilitate outcomes. We're not trying to manufacture anything. We're trying to make it happen the way that it will be sustainable. When you're trying to manufacture things, which we've done a lot of in Mississippi,
they fall by the wayside. They don't.
But when you incentivize, when you open doors, when you provide that hand up, then things happen.
Yes.
And so, and one thing I'm communicating is how expensive poor health is in this state. And the fact we have attacked poverty by making a lot of attempts investing in programs pointed at poverty that have not worked. But I see a clear linkage between poverty and poor health. And it's a dog chasing its tail.
Wow.
And it is a system that is self-perpetuating. So what I've been advocating the last 2 years is, okay, let's stop doing what's not working and let's try something else. And so this last year, I took our top 3 causes of death in Mississippi, which are largely preventable. And that's cardiovascular deaths, cancer deaths, accidents, which we lead the nation in firearm deaths. A lot of those are little ones. And then we tacked on maternal infant death because I knew
we can make a difference there
too. So out of those 4 causes of death, I had an independent health economist calculate the burden to our economy. And just from those 4 things, it is around $30 billion a year.
I believe it.
So over 10 years, $300 billion that has been lost from our economy. But that money didn't just evaporate. That money went other places.
Of course.
Outside of Mississippi.
Of course.
And so here is a great opportunity for economic development by investing in the health of our people through providing access to care. By investing in the hospitals like we desperately needed to, and that has worked. By investing in the emergency medical system. By investing in population health, which is through us. By investing in mental health, which is, that is a high impact cost to our state. The poor outcomes with mental health. And then I'm a big believer, public health is public wealth.
Public health is public wealth.
It goes out to all of us.
Now that needs to be the billboard.
So whenever we invest in somebody in the Delta to give them a chance to live and to be healthy
Mm-hmm.
and to be a productive member of our society because they're now healthy, or they don't wind up dying unnecessarily, then I benefit.
Of course, what I hear you saying is that by lifting up these parts of our state, we're lifting up the entire
The
state.
entire state.
Yeah, we're all coming out.
All right.
Listen, you segue very well into something I spoke about this past second Tuesday. I played a clip of a young woman sharing her experience with sickle cell and with gene editing treatment. You know, you talk about access. I want you to listen to this, Dr. Edney. access. Something that we find works, people by and large can't access it. $2.5 million per treatment. The Mississippi Delta with billions being pumped into it, and it's still looking and suffering from some of the same ills. We developed a SARS-CoV-2 vaccine that helped to helped to basically bring to a halt this horrible pandemic. And we did that in speed time. My question, Dr. Edney, is what is your response to this young lady, Miss Victoria Gray, and her story, you just heard it, and to others like her that need access to this life-saving medication, access to life-saving resources in the Delta even? How can we speed this up?
Well, that's the CRISPR therapy for sickle cell and other inherited genetic disorders is a game changer, and that's why it was on the fast track for FDA approval, and things like that. Then the Medicaid program will have to cover, and the Medicaid program is looking at the proper ways to fund treatment for these patients without destroying the budget.
They're looking at ways without destroying the budget.
But the way I look at this is that $2.2 million was applied for her treatment.
Mm-hmm.
Investing in her was economic development.
Huh? Did you hear how she went back to work?
Because now she has a life.
Uh-huh.
And now she is not going to be a burden on the healthcare system, no fault of her own. But the cost of her care was way more than $2.2 million, and she's relatively young.
Mm-hmm.
And as an internist, I was taking care of sickle cell patients in their 50s, which is really sad.
It's sad. Uh-huh.
And then to know that they didn't say if any of her children inherited it, but any of her children who possibly did, or it could be her grandchildren are going to have it, they won't suffer the way she has suffered.
That's right.
And that, in the past, virtually every sickle cell patient was lost to the economy because they became disabled as adults.
So either we're going to pay for it on the front end, or we're going to pay for it on the back end.
That's right.
And I, as a family medicine trained physician, care about prevention. Can we prevent it?
We're going to come back and continue.
Yes.
We got another program.
Isn't that something?
Yeah. Let's close out Dr. Liddell.
Well, to close out such a powerful meeting with Dr. Edney, you have to basically give him the final word.
Make it be part 2, 3, and 4. He's
Well,
no stranger, and certainly, Doc, thank you. An hour and a half is blown by. Your last words and comments, and what would you like for the citizens to do? Because we got to get involved.
I would like for all of us to take better care of ourselves and to listen to the good information Dr. Liddell is promoting through this program, and making that investment in our individual health and well-being that then will multiply into our communities. And as we are healthier individuals, we will have healthier communities. As we have healthier communities, we will have a healthier society. And I am a big believer, public health is public wealth. We will be a wealthier society.
I was just about to say that our public health is our public wealth. Listen to the Literacy Hour on next Tuesday, starting at 7 a.m. right here on WMPR 90.1 FM. You can also catch us on WFQY 99.1 FM and WGDQ 93.1 FM. I know I got some calls as well, some texts saying, can we call in? You guys want to ask a question, but listen, we're going to have to save it, table it for another time. Maybe next Tuesday, you can just call in with your questions, and If any are for Dr. Edney, we'll get those to him. He won't mind answering them. But thank you for listening, and you all have a great rest of your day. Bye-bye.
For the past 1 hour, you have been listening to the Literacy Hour with Test Taking Solution and your host, Dr. Kentrell Liddell, MD.
Thank y'all.
MBA. We are
Get the word out about our babies.
4,000 Oaks Drive in Jackson, Mississippi. Visit us on the web at www.testtakingsolution.com. Join us each Tuesday from 7 to 8 a.m. for another life-changing conversation here on WMPR 90.1 FM, the voice of the community.